Hi, I am Dr. Kim Sage. I'm a licensed clinical psychologist. Welcome to my YouTube channel and to this video on PTSD, post-traumatic stress disorder. If you're new here, please check out my links below on online courses and checklists and resources, and please consider subscribing and clicking that little box, checking the little box. That way you'll get notified when I post new videos. So I want to talk about PTSD from the sort of what it shows up in our lives perspective, not so much for the line by line diagnostic criteria. There are a million great videos on doing that. But I want to get to the heart of kind of what happens with post-traumatic stress disorder. And then as we'll go on, hopefully, and talk more about how this relates to CPTSD and other disorders around trauma and childhood stress. And then I really want to get into, in the next few weeks, the relationship dynamics that show up, as I've talked about in many of my other videos on attachment and relationships and things of that nature. So the first thing to understand in terms of how we diagnose PTSD is that you must have had an experience or an exposure to an event or some events that tend to be related. So what do I mean by that? I mean that as opposed to like complex PTSD, which is about, let's say, relational trauma, an ongoing pattern of wounding, let's say from parents or other relationship violations where you could or should have been safe. Those can really vary. But the PTSD type trauma is something that happens at a moment in time generally. Now it could be like that day, like a robbery. It could also be going to war. But you can understand how the war would be a repeated exposure to the same related event. So at the heart, you must either directly experience a traumatic event, you must witness it in person as it occurs to others, you must learn about a traumatic event as it occurred to a close family member or close friend, and in cases of actual or threatened death of a family member or friend, the event must have been violent or accidental, which is different from, say, a grandparent passing away, which is very traumatic for many of us, but not the same in terms of the criteria for this specific diagnostic tool. And then experiencing repeated or extreme exposure to aversive details of the traumatic event. What does that mean? The DSM-5 gives the example, this is our manual. I know, not perfect, but what we have. For example, first responders or police officers who are repeatedly being exposed to very difficult types of violent traumatic events, right? And so they're exposed to that in an ongoing way. Now, in order to make the diagnosis, you have to have at least a group of symptoms. I'm going to go into those in a second. But basically, one of the symptoms is a re-experiencing. At least one is an avoidance symptom. At least two are arousal and reactivity symptoms, and at least two are cognition and mood symptoms. And so what do I mean by those? So re-experiencing is like flashbacks, nightmares, frightening thoughts, intrusive thoughts, right? You're just going back. It's almost like it's already, it hasn't already happened. It's happening again, newly for you each time. So there's a re-experiencing, and it really reminds you of the trauma. Number two, the avoidance symptoms. Remember, these are things that we're doing to sort of avoid dealing with being exposed to what might trigger us. And so we're staying away from places or events. We are avoiding thoughts or feelings. We might try to stay really busy and not deal with it. So it's a strong attempt to avoid, not to kind of deal with it. Arousal and reactivity symptoms, in which case they cause us to be easily startled. That's that high startle response. Feeling on edge or tense, having difficulty sleeping, having sudden, emotional outbursts, like angry outbursts. And so you're just like emotional in ways you can't control. And lastly, cognition and mood symptoms. And so you can't remember things about the event. You have negative thoughts about yourself and the world. You might feel numb or lots of blame or guilt. It's somehow your fault, even though when you go back and look at it, there's nothing you could have done differently. You're not really interested in things you used to enjoy, and you have trouble concentrating. Now, those have to occur, as I said, and they have to go on for at least 1 month. And if they're less than that, we'll get into another video, we would call it more of an acute stress disorder. But what I want you to understand about this disorder in terms of PTSD is how profound its impacts can be upon your life. So if we're talking about these ongoing experiences, many people, especially if these things happen, let's say in childhood, often didn't get therapy. And so they're doing the best they can. They're sort of white knuckling their way through life. But these manifestations of avoidance and re-experiencing, and then you think about, okay, if most of us are going to have at least one significant traumatic event, most everyone you know has had more than one, but you start to connect that to, let's say, complex trauma. So let's say you have experienced an event like something violent, like maybe your friend died or something in childhood on a bike accident. Maybe you were there, for example. And then you also had parents who were chronically angry or, unsafe, or they went through a terrible divorce. So you can see how these things start to connect and collect. And that is what I want to make clear through all these videos, is that we often think about, PTSD just being a war event, but through treatments like therapy and EMDR, different types of exposures in terms of exposure to therapies like somatic experiencing in our bodies, all kinds of work. Remember that these traumas, just like I talk about so much in complex PTSD, are living in our bodies, in our nervous systems. And so that's often showing up in relationships and how you see yourself, right? If you somehow still as a child, let's say there were the two friends on the bike situation and they didn't survive and you did. You might be carrying survivor's guilt your whole life, but maybe you were really young. Maybe you were 6 or 7 and you think of that as like this past event, but it plays out in how you never feel worthy. You never feel good enough, or you're always afraid something bad is going to happen in any moment. So when you're a parent, you're terrified of letting your children have exploratory behaviors, right? That goes back to, let's say, anxious attachment. And so you live in a lot of fear. So that's why I think it's important to begin to identify the trauma impacts in our lives, not just the relational ones, which I talk about so much, but how those might connect, like I'm saying, to other significant traumatic events. And just lastly, there are a few things that can make you even more at risk, actually, I want to cover. Those are women, being born female, having had trauma in your childhood, feeling horror, helplessness, or extreme fear, going through a traumatic event that lasts for a long time, like the war situation or being exposed to violence in some way, having little or no support afterwards, which is a huge issue in terms of how you receive support, dealing with extra stress after the event, such as the loss of a loved one, pain or injury or loss of a job, right? So now you have financial issues, and certainly having an issue of mental illness or substance abuse. All of those things can be ways we try to deal and cope, but life sometimes just hits us again and again and again. And so it is important to honor those experiences in yourself. I'll link more resources down below on this diagnostic criteria. But what I want you to hopefully get out of this is a validation of how this is a whole web of your life, right? It's not just that one thing in childhood. It's all of the things. And then all the things in your adult life. I've actually had a lot of adult trauma that I already had a lot of trauma in childhood. And it has been, even my therapist has said, a lifetime of trauma. And so that's hard to get out of. That manifests in hypervigilance and anxiety, can manifest in depression, difficulty trying to let go of control, fears of loss, all the things I've talked about in the last few weeks too, about how that toxic parenting can affect us, really can show up in our lives. And so that is really my hope, is that you will find ways to validate and support and love yourself and know that your story is worthy and you are worthy of healing. I will see you tomorrow. We'll talk more about these disorders. And like I said, we're going to really head into what I'm excited to talk about more, which is how all this stuff can show up in our relationships. So thanks for watching. Please stay safe and well. I'll see you tomorrow.